Psoriasis. It's a word that can cause confusion and concern. You might picture red, flaky patches on the skin, but psoriasis is more than skin deep. It's a chronic condition. This means it lasts a long time, often coming and going throughout life. Psoriasis is an autoimmune disease. The immune system, meant to protect us, mistakenly attacks healthy skin cells. This causes rapid skin cell buildup, leading to those telltale psoriasis patches. Imagine your skin cells like a well-organized queue. In psoriasis, the queue is disrupted. Cells are produced too quickly and pile up on the surface. This leads to inflammation and the visible signs of psoriasis. While psoriasis is common, affecting millions worldwide, it's not contagious. You can't catch it from someone else. This is important to understand. It helps to reduce stigma and encourage open conversations about psoriasis. Psoriasis can impact anyone, regardless of age, ethnicity, or background. But knowing more about it can empower you to manage the condition and live well. The exact cause of psoriasis remains a mystery. However, research points to a combination of genetic and environmental factors. Think of it like this. Some individuals inherit a predisposition to psoriasis. It's like having a loaded gun. Then certain triggers pull the trigger, causing psoriasis to flare. These triggers vary from person to person. Common triggers include stress, infections, and even certain medications. Stress is a big one. It disrupts the body's delicate balance, potentially triggering an immune response that leads to a psoriasis flare-up. Infections like strep throat can also set off the immune system, triggering psoriasis symptoms. Even seemingly harmless things like cuts, scrapes, or sunburn can trigger a flare-up in some individuals. This is why understanding your individual triggers is crucial. By identifying and managing these triggers, you can potentially reduce the frequency and severity of your psoriasis flares. Psoriasis is known for its visible symptoms, primarily affecting the skin. The most common type, plaque psoriasis, appears as raised red patches covered with silvery white scales. These patches, called plaques, can be itchy and uncomfortable. They often appear on the elbows, knees, scalp, and lower back, but can affect any part of the body. However, psoriasis is more than just skin deep. It can also manifest in other ways. Some people experience joint pain and stiffness, a condition known as psoriatic arthritis. Nail changes such as pitting, discoloration, or separation from the nail bed are also common in psoriasis. It's important to remember that psoriasis symptoms vary from person to person. Some experience mild symptoms, while others have more severe cases. The severity of symptoms can also fluctuate over time. You might have periods of remission where symptoms are minimal or absent, followed by flare-ups where symptoms worsen. Navigating treatment. Finding what works for you. There's no one-size-fits-all cure for psoriasis. Treatment focuses on managing symptoms and improving quality of life. Your doctor will consider various factors, including the type and severity of your psoriasis, your overall health, and your preferences, to create a personalized treatment plan. Treatment options range from topical creams and ointments to light therapy and systemic medications. Topical treatments are often the first line of defense for mild to moderate psoriasis. These creams and ointments work by reducing inflammation, slowing skin cell growth, and moisturizing the skin. For more severe cases, light therapy, which involves exposing the skin to controlled doses of ultraviolet light, can be effective. In some instances, systemic medications, which work throughout the body, may be necessary to manage psoriasis. These medications suppress the overactive immune response that drives psoriasis. Your doctor will work with you to determine the most appropriate treatment approach based on your individual needs and circumstances. Your story matters, sharing experiences and finding support. Living with psoriasis can be challenging, but you don't have to face it alone. Sharing your experiences with others can provide invaluable support and understanding. Consider joining a support group or connecting with others online. Hearing from people who understand what you're going through can make a world of difference. Remember, seeking help is a sign of strength. Don't hesitate to reach out to a healthcare professional for guidance and support. They can answer your questions, address your concerns, and help you navigate the challenges of psoriasis. We encourage you to share your thoughts and experiences in the comments below. Your voice matters, and your story could inspire and empower others facing similar challenges. Let's create a supportive community where we can learn from each other and find strength in shared experiences.